Assalamu alaikum. Welcome to Second International and Biomedics Conference 2024, organized by Department of Physiology, Government College University, Faisalabad. I am Dr. Madeeha Arshad from University of Education, Faisalabad campus, and the topic today we discuss is determination of hepato and spleeno toxicity induced by iron oxide nanoparticles in male albino mice. Toxicology is a study of the effects of chemical, biological, and physical agents on living organisms, particularly humans. And toxicants are the chemicals or a mixture of chemicals that present a risk of death, disease, injury, or birth defects in exposed organisms at certain doses. Toxicants can be found in air, soil, water, or food. General toxicants are drugs, environmental toxicants, radiations, chemicals, heavy metals, and infections agents. We are discussing about iron oxide. Iron oxide is a compound made from iron and oxygen. There are 16 known iron oxides and oxyhydroxides, the most famous of which is rust, a type of ferric oxide. Iron oxide and oxyhydroxides are widespread and play important role in many geological and biological processes. Iron oxide occurs in red-brown in color, insoluble in water. Cubic crystal structure is its density is 5.42 gram per decimeter cube. Soluble in sugar solutions, diluted acids. Its molecular weight is 159.69 gram per mole. While its chemical transition metal, it has plus 2 and plus 3 oxidation states, having different oxidation states used for electron plating to make alloys and rust with moist air. Iron oxides are used to tint sunscreen, create complexion enhancing makeup shades, help protect skin from visible light. Iron oxides are considered to be safe as used in cosmetics and personal care use. They are non-toxic and non-allergic. Iron oxide are well tolerated by those with sensitive skin. But there are some disadvantages of iron oxide, just like it can affect you when breathed in. Exposure to iron oxide fumes can cause metal fume fever. This is a flu-like illness with symptoms of metallic taste, fevers and chills, aches and chest tightness and cough. Prolonged and repeated contact can discolor the eyes, causing permanent iron staining, or it may damage to the neural tissues through iron accumulation and oxidative stress. Its route of exposures are dermal contact, inhalation, absorption through skin, or gastrointestinal ingestion. Mode of action of iron oxide is it is absorbed through the membrane, depolarization, diffusion, or endocytosis. It causes DNA damage. Stop DNA repair mechanism, yielding oxygen-free radicals, causing protein debasements. A decreased concentration of hepatic glutathione in liver and other cells. Change configuration of DNA building proteins, cause change in transcription of genes. Here we can see iron oxide nanoparticles can enter into the cells via membrane, depolarization, diffusion, or endocytosis. The objective of this study was to evaluate the toxicological effects of iron oxide nanoparticles on the liver and spleen, also to check the alterations in the liver functioning test and complete blood test profile. Histopathological analysis of liver and spleen was also taken into account. Plan of work. Study design was based on LD50 value, which were calculated as 66.668 grams per kg. There were total 4 groups. First one is a control group, which were given not any kind of this treatment, while dose group include high dose group, which is 33 gram per kg, medium dose group 17 grams per kg, and low dose group 8 gram per kg. Animal used in this experiment was male albino rats, Rattus novargicus. which were placed in steel cages of size 8 to 14 inches, and they were given with 12-hour standard light and dark conditions. Humidity was maintained at 40 to 45 degrees percentage. Food was provided with chick feed number 14, and water was ad libitum. Iron oxide nanoparticles prepared in the lab were given orally, diluted in distilled water for 1 month, 30 consecutive days. Total 20 mice in 4 groups were divided: control group, low dose group, medium dose group, and high dose group. Ethical consideration according to UE Ethical Committee was observed: clean water, chick feed number 14, temperature, humidity, standard light and dark conditions, and animal safety measures were applied. During dissection, dissected through the cervical disjunction by using surgical gloves and laboratory preventive measures. After 30 days, 31st day was considered as acclimatization period, and on the 32nd day, dissection was done. For biochemical testing, blood was collected in vials for LFT and CBC, while liver and spleen were extracted for histopathological analysis. Histopathological testing was done by hematoxylin and eosin staining, uh, and slides were prepared. Biochemical testing was done as the extracted blood was taken in EDTA vials from cardiovascular puncturing, and it was taken to lab for CBC and LFT. For the data analysis, SPSS 21 software was used, 21.0 version. One-way ANOVA was applied for the mean comparison, and the significant difference between control group and dose group were measured. Results. Here are the parameters for LFT liver functioning test. If you see that bilirubin, the control group and the dose group, they do not show any significant difference. This means that bilirubin was not changed by the iron oxide nanoparticles. Similarly, bilirubin direct or indirect were also not significantly different from the control group, except from the higher dose group. While alkaline phosphatase in low group was decreased, while medium dose group and high dose group was while alkaline phosphatase was increased significantly in medium dose group and high dose group, and in low dose group, alkaline phosphatase was significantly reduced from the control group. Similarly, ALT, uh, there is no difference in low dose group, while medium dose group showed a high significant difference from the control group. AST also showed medium dose group and high dose group from the control, they were significantly increased. In CBC, only RBCs was significantly different from control group in low dose group and higher and medium dose group, while all other parameters, hemoglobins, WBCs, platelets, HCT, MCV, MCHC, and RDW were not significantly differed from the control group. Leukocyte counts, only in eosinophils, low dose group was significantly different from control group. Other parameters, neutrophils, lymphocytes, monocytes, were not significantly different from the control group in all other dose groups. Now we talk about histopathology of liver. You can see here the histological sections of liver, control group and low dose group. photographed and at 40x from the rat, illustrating normal structures, that is normal hepatocyte, sinusoidal spaces, and central vein. Here we can see there is not much difference in control group and low dose group, which shows that low dose group that was 8 gram per kg did not cause any injury or harm to the hepatocytes. In this slide, histological section of liver of medium dose group and high dose group photographed at 40x from the rat, showing normal structures, that is normal hepatocytes, sinusoidal spaces, vacuolization, while some of the nucleus became binucleated and the central veins disturbances are observed at high dose group. Histopathology of spleen. The histological sections of the spleen photographed at 40x and 100x from the rat of a control group and low group, showing normal structure, white pulp, red pulp, trabecular artery, and macrophages are visible. So here, in this group also, low dose groups do not show any toxicity in spleen, as it was just like control group. In this slide, histopathological sections of spleen photographed at 40x and 100x from the rat of medium group and high dose group, illustrating normal structures of, that is white pulp, red pulp, and a small amount of hemosiderin. Here also, in this spleen, there is no disastrous histopathological sectionings were seen. Conclusion. No significant changes were observed in biochemical parameters. Similarly, markedly lower RBCs, MCV, and HCT levels cause iron deficiency anemia, microcystic anemia, fatigue, dizziness, and shortness of breath, while an increase in WBC's level cause infection or inflammation of the body and bone marrow diseases. High platelet counts level, which causes thrombocythemia. Iron oxide nanoparticles affect the liver, does not affect the liver and spleen tissues of the albino rats. Thank you so much.